All right, part 4 of what those things on your urine analysis mean. Previously, we covered the physical exam of the urine analysis and the entire chemistry portion, and now we're going to cover more in detail what the microscopic analysis means. So what you have with the microscopic analysis is a lab tech physically taking your urine and looking at it under a high-powered microscope. And what they're looking for is cells, casts, crystals, microorganisms, things like that. And in general, normal urine contains up to 3 to 5 red blood cells or lower than 5 white blood cells. If it's higher than that in any fashion, then there is something else going on that requires further workup. What is interesting on the microscopic exam is that different crystals will actually look a little bit different under the microscope. And so very often the tech will be able to note down what the crystals look like physically and suggest what they could be. Now, if there is someone who is a stone former, then this could be really important information as to how you would prevent kidney stones depending on like what type of crystal you have in your urine. And ideally, you don't want to have crystals in your urine because crystals are basically just like teeny tiny stones, right? And at the point you get a kidney stone is when those crystals become big enough to cause you significant amounts of pain. Now, another finding that you might see in a microscopic report is casts. There are different types of casts, and basically what casts mean is they look like these little tubular structures. These are basically stuff that got stuck in the tubules of your kidney as it was filtering and got pushed out into your urine. So let me go over some of the most common casts that can be seen. Hyaline casts are generally a normal finding. It can be more present after exercise or dehydration. We pretty much want to make sure that if there is a finding of hyaline casts, that on a repeat urine analysis when the person is more hydrated, these typically should resolve and go away. Any other cast is generally not so much of a good sign. So if you've had red blood cell casts, this is pathognomonic for glomerular nephritis. This needs to be worked up immediately and the kidney needs to be treated. Red blood cell casts are very highly specific and they indicate active glomerular inflammation. White blood cell casts are more suggestive of interstitial nephritis or pyelonephritis, also a really bad thing. This means that you probably have an infection and you need to also get that worked up and probably get antibiotics because organ infections are really severe. Another thing that you can see in pyelonephritis is actually like renal cells, and like your kidney cells are not supposed to show up in your urine, and if this is happening, typically you have something going on with your kidneys. Now, if you see granular casts or renal tubular epithelial cell casts, which is abbreviated RTEC casts, this usually means that there's some tubular injury inside your kidneys. Also not good news. This also needs to be worked up. Fatty casts are associated with nephrotic syndrome. Another thing that needs to be worked up and treated. If you have waxy casts, generally waxy casts are indicative of chronic kidney disease. And then there are some funky ones like light chain casts, which is more indicative of myeloma or cast nephropathy. And then there's pigmented casts, which usually are composed of hemoglobin or myoglobin, and they suggest that there's something going on with intravascular hemolysis where your red blood cells are for some reason exploding inside your blood vessels. The myoglobin cast can be an indicator of rhabdomyolysis, which can be an outcome of if somebody reacts to like statin medications and stuff like that. So yeah, this is a basic overview of the microscopic exam of a urine analysis, and now we've covered all sections of a urine analysis. If you guys have any other lab testing, routine lab testing that you would like to know a little bit more about, please let me know in the comments. And I think this education is really important to push out to people to kind of help get an understanding of what your labs mean. Of course, talk to your doctor about the results of the labs and see what they have to say. But as always, I think understanding your lab results to a certain degree and having that conversation with your doctor is a really helpful tool to be able to have a better doctor-patient relationship and be able to utilize your time in the office with your doctor as much as possible. So, hope that helps. Thanks.